A young person on dialysis has 1,000 times the risk of heart disease, and often patients die of heart disease before even going to dialysis. I've worked in a number of different institutions, and the thing that was most noticeable when coming to Western Health was the diversity of patients and their socioeconomic circumstances, as well as their different cultural backgrounds. There are many factors that contribute to the high rate of chronic disease here in the West. The socioeconomic determinants, the multicultural backgrounds, also risk factors, high BMI, high rates of diabetes, and potentially other lifestyle factors. We can't ignore the overlap between all of these chronic diseases. We have twice the incidence of diabetes compared to national averages. We see about 30% of people arriving to dialysis within 3 months of actually knowing that they've got kidney disease, which is one of the highest rates in Australia. A lot of it is caused by people not being tested at the right time and getting symptoms and then having tests with their primary care doctors. The Western Health Chronic Disease Alliance is presently running a program called CD Impact, Chronic Disease Impact, which is working with primary care to actually detect disease early in people at risk, get people tested, get people diagnosed, and get people managed in a timely way. This is essential to be able to move into the future to prevent more disease. Often dialysis patients don't get a chance to work to establish themselves financially, and we've actually had some dialysis patients unable to afford their medications. One striking example I can think of is a young woman who is around 55 with terrible heart disease, terrible airways disease, as well as chronic kidney disease. In addition, this patient had terrible social circumstances. As a result, she was forced to beg with other dialysis patients in the unit. Western Health worked with her and the social work team to actually link her to community services and provide support for her to be able to afford her medications. With the Greatest Need project and the Western Health Chronic Disease Alliance, we believe that we can actually get people on treatment, enable them to live fulfilled working lives. Having that financial stability from more working years could actually help people in their healthcare delivery in the future as well.